In this video, we are going to look at microcytosis. So even before we put the slide on the microscope, we're going to look at the analyzer printout. And the red cell indice that's going to give us information about what we can expect to see is the MCV, the mean cell volume. And the normal range on that, depending on your source, typically tends to be like 80 to 100 femtoliters. So on this particular patient, we see that the MCV is 72, so below normal. So I would expect to see microcytic red cells, or red cells that are smaller than normal. So you can do a red cell assessment on 40x high dry objective lens. I've gone up to oil 100x just so we have a little clearer picture, closer look at what it is I want you to see. And when it comes to judging red cell size, I always like to use white blood cells, and specifically I like to use small lymphocytes. So here we have a small lymphocyte right in the center, and typically a red blood cell can easily fit within a small lymphocyte. So looking at the lymphocyte in the very center, I would say at about like 7 o'clock, meaning to the bottom and to the left, we can see a red cell that looks pretty like normocytic, meaning normal in size. But if we look at 6 o'clock, we can see one that's slightly smaller. And I would say that that's a good indication of what the instrument printout is telling us about microcytic red cells. It's slightly smaller than the red cell to the left. You probably could fit 2 to 3 of those smaller red cells inside that small lymphocyte. So based on what I'm seeing on the printout and what I'm seeing on the microscope, I'm pretty confident that I can say that there is probably 1 to 2 plus microcytosis on this patient. Now, something that we'll move around here a little bit because there is something else I want you to see. Let's see here. Okay, so in the center we have indicators of anisocytosis, and what that means is that we have variation in the size of the red cells. So the instrument printout is the information it's going to give us related to that is the RDW, the red cell distribution width. And sure enough, on this patient, the RDW normally is like 11.5 to 15. And this patient has an RDW of 19. And that supports what I'm seeing here, because in the very center I see a big red cell, and then around it I see smaller ones. Therefore, I would probably call 2 plus anisocytosis on this particular slide. Now, another thing kind of interest here is we have a nucleated red blood cell. Those are something that you don't normally see on the peripheral smear and that you would put on your differential report. Okay, the last thing that maybe is of interest of this slide, and you may notice here that, let me find a good field here. Okay, so in the center here we have a couple few red cells that have an increased central pallor. So in the very center, you have 2 red cells right next to each other. One of them has almost no central pallor, and then the one to the right definitely has an increased central pallor. And what that is, what we would look at in the analyzer printout is the MCHC, the mean corpuscular hemoglobin concentration. And normal for that is usually 32 to 36 grams per deciliter, or it can be reported out as a 32 to 36%. So on this particular patient, the patient's MCHC was 30, so that supports the fact that we may see on the peripheral smear some hypochromic red blood cells, meaning that they have an increase in the size of the central pallor.